This is the story of 5 small enterprises that chose to change the way they conduct their businesses. Their story is a representation of nearly 40 others scattered around 24 districts in Uganda. The change they adopted have improved the supply chain management practices of their businesses. These changes include: they offer performance incentives of a better price for quality maize to farmers and agents to motivate them to increase volumes of good quality maize. The changes that appear minor are positively impacting the maize value chain. This is the story of a few steps that achieve great distances.
Naapera mapesa nasomesa bizukulu banne baafuna zidigiri mulali ku master akola erira akola Kampala nimbakire menso yebuze kale agenti wose ekimusima kukikolagana era bigali byesi imufunamo nasi.
All these developments are bringing smiles to players in the maize value chain.
By building that relationship with my agents in the villages and farmers group, I am able to get more grains from different farmers.
As she goes about her work, 32-year-old Rehema Chehemba, a resident of Kachera village in Mitoma district, receives a rare visitor. Her visitor is a village mate, 40-year-old Nora Nagasha. Nagasha is here to know what agricultural inputs Rehema requires for her coffee and banana shambas. After receiving Rehema's order, Nagasha travels 7 kilometers away to Katenga Trading Center. She's here to see Adrian Gacharo, proprietor of Gacharo Adrian Agro Input Shop, the local source of agro inputs. Nagasha comes with orders of agro inputs from her village mates in Kachera. At Adrian's shop, Nagasha and Adrian go through each farmer's order before Nagasha makes payments. The relationship between Rehema Chemba, Nora Nagasha, and Adrian Gacharo is a living example of the village agent retail model, a model that is delivering genuine inputs, increasing farm harvests, and transforming lives. In Uganda, poor access to genuine seeds, planting materials, fertilizers, and agrochemicals is an overtold story. Its icing is farmers and farmer groups' lack of appropriate technical advice in the proper use of purchased inputs. In order to address these rampant problems, a selection of agro-input dealers in Uganda have adopted the village agent retail model. Using the model, they've established networks of community-based agents who collect, place orders, and deliver bulk agricultural input to farmers. The Village Agent Retail Model, also known as VAM, is a low-cost, flexible, and scalable inputs distribution system that is enhancing chain relation between farmers and input suppliers. The elements of the model are: 1. Proper agent selection, which involves identification and selection of the right type of agent at the sub-county and parish level. 2. Performance incentives, which involve financial and non-financial rewarding for good performance. 3. Outreach and promotion, involves product demonstrations by stockists through extension meetings and media. 4. Continuous improvement, involves the stockist conducting regular review meetings with agents to upgrade technical and management competencies.
Some of the products which I don't know to use, I now know to use them. and even I'm trying to get more from him.
Mfuniremu habokuba nkaitwe abagenti twina aka percent kaito katito katufunaho hamuli mogo kandi kyakani nyeyongera kumanywa omulimo gwange
kakati nafunye edduuka etuufu ne bembanga ekintu tekintambulidde bulungi nsobola okukizaayo ne mugamba waayo ekintu kino tekigenze bulungi nzaawe nganyiriddwamu naye tubadde tugula mu butale agamu amadagala olusi tubadde tugagula mu butale kati buli wakati tekigendedde bulungi mbadde nga sirina gye nnyinza kugamba nti waayo okuddayo nti munnaye eddagala lino teryakola bulungi oba ensigo gye wanguza yagaana okumera.
In the early days of Uganda as an independent country, the nation's then major cash earner, coffee, enjoyed global popularity alongside big exporters owing to its quality. In the 1990s, when the industry was liberalized, the quality of Uganda's coffee began to decline. Industry experts attributed this to the free industry and exit of players alongside other factors. Concerned about the plight of the industry, stakeholders have been at work to remedy the falling standards of coffee quality in Uganda. This video introduces small enterprises that have taken simple and obvious steps to improve the coffee value chain within their areas of influence. David Chimbugwe is proprietor of Bulime Coffee Factory in Luwero District. Paul Mbazira is the managing director of La Rev Coffee Factory in Rakai. Julia Sisabirie is proprietor of Ayamba Coffee Factory in Kamuli, and widowed Medina Sempela runs Alamanse Coffee Factory in Mubende District. We also meet the farmer-owned Chibenge Cooperative Society in Masaka District, Ankole Coffee Processors Limited in Ibanda District, and the sole proprietorship Katenga Mpangale Coffee Factory in Mitoma District. The story of these coffee processors is a story of local efforts to get Uganda's Robusta to win the cupper's favor while improving lives of Ugandans. Coffee hullers and processors in Uganda occupy a strategic position and play a key role in the coffee value chain. This is because they have vast influence over the quality of coffee beans that come from farmers and goes up the value chain to the garder and exporters. They also bear the information on the quality standards required by exporters. They have also acquired the tools of the trade such as moisture meters. Bulema Coffee Factory in Luwero is owned and run by David Chimbugwe. Like other coffee hullers, David uses a moisture meter to assess the moisture content of his suppliers.
It was guesswork and working through experience that this is moisture 18, it is supposed to be cut this. But at times I would make losses, like you undercut, you take to a company and they overcut you, then you make a losses.
Previously, the norm was to buy dry green coffee beans, locally known as chiboko. These hullers have adopted a new approach of buying processed FAQ locally, referred to as kase.
Emmwanyi za kase kale ekisooka nti mu byonna bwengula emmwanyi za kibooko nti abantu olusi banguza emmwanyi ezitakaze bulungi, ekyo kimu. Ekyokubiri nti siba na ntegeka bulungi mu factory yange nti ate ono kibooko ate ono kase, so bwe mbeera nti ngula kase mba ngula kase yekka n'ebitabo byange mbibala bulungi nga ngula kase yekka.
These are the remains of 75-year-old Mary Nalwada's mud and wattle house. It collapsed over a year ago. Today, this is her home, which she shares with 2 granddaughters, children of her son, who died of HIV/AIDS. They have endured the harsh weather in this space that is less than 50 square feet. Mary Nalwada is a resident of Rakai district in southern Uganda. The district hit national and global headlines in the 1980s at the outbreak of the HIV/AIDS epidemic. The first cases in Uganda were reported here. The district was gravely affected as thousands perished, leaving behind social and economic deficiencies. As HIV/AIDS continued to spread, the district's neighboring Rakai, that include Masaka, Liantonde, and Sembabule, were equally affected. Today, thousands of families live in the shadow of the epidemic, characterized by orphans, abject poverty, and indecent housing, amongst others. A typical day on a street in Kampala, the capital city of Uganda, the Pearl of Africa, could be delightful for a unique eye. However, a 3-hour journey north of Kampala to the Acholi sub-region reveals a different story. For more than 20 years, the region suffered a vicious civil conflict as government troops and rebels of Lord's Resistance Movement fought running battles. At times, more than 1.5 million people were displaced into camps, dependent on humanitarian assistance for their survival. It was the world's worst forgotten disaster. Long before the guns had gone quiet, international humanitarian organization GOAL was at work here. Working against all odds, GOAL teams delivered much-needed help to thousands of people.
At that point, it was mainly an emergency response to emergency needs that had come up as a result of the displacement of people from their homes as a result of the war.
Since 2006, security and with it the humanitarian situation has improved dramatically. Among the institutions for which GOAL has built capacity is Dr. Ambrosori Memorial Hospital, Kalongo. GOAL built and equipped a voluntary testing and counseling VCT center, which has been instrumental in preventing mother-to-child transmission of HIV/AIDS, PMCT. Dr. Josephine Okwera is the officer in charge of the HIV program at the Kalongo Hospital and works in close collaboration with GOAL.
GOAL also does mobile VCTs to test the people within the camps, and those who are found to be positive, we have more support from GOAL in terms of psychosocial support, and basic care packages also have been given out to them. On a number of occasions also, GOAL has given us oral rehydration solutions to be given out to these HIV patients, and they do also home-based care for the patients who are bedridden and within the communities. They have trained a number of home-based care providers within the communities that help us take care of these patients. And we also have community volunteers that have been trained by GOAL to follow up the patients from their homes. We have also community counseling aides who have been trained by GOAL to provide the psychosocial support for the HIV patients.
International humanitarian organization GOAL began operations in Uganda over 20 years ago, and over the years, the organization has consistently delivered development and emergency recovery programs for communities in several parts of the country. As an organization working for the poorest of the poor and most vulnerable, GOAL knows that children are among the most vulnerable. Aware that in delivering intervention programs, her staff are in constant contact with children, the organization has adopted and is mainstreaming child protection activities in all its operations.
Everywhere, anywhere, a child can be abused, and everybody is a potential abuser. So as organizations working for children, it's a legal requirement. According to the United Nations of the Rights of the Child, every child has a right to be protected. So it is our obligation to protect the children we work with, directly or indirectly.
According to the World Health Organization, child abuse or mistreatment comes in many forms, and they include physical or emotional ill treatment, sexual abuse, neglect or negligent treatment, or commercial or other exploitation resulting in actual or potential harm to the child's health, survival, development, or dignity in the context of a relationship of responsibility, trust, or power. As an organization with specific focus on vulnerable children, GOAL believes it's her duty to ensure that promotion of child's rights includes specifically protecting children from accidental harm, as well as deliberate abuse within any organization intended for their benefit.
The mainstreaming activity in GOAL is about reducing risks within GOAL and its funded partners.
Friends of Christ Revival Ministries, FOCREV, and Uganda Reproductive Health Bureau are some of the many partners GOAL is working with in Bugiri District to deliver much-needed hope for vulnerable communities. GOAL is supporting her partners to mainstream child protection in their activities. GOAL believes that partners without protection policies, guidelines, and systems are more vulnerable to false or malicious accusations of abuse.
It has empowered our staff through workshops. We even have a technical officer in charge of child protection who actually keeps backstopping our child protection focal person every month. Yeah. And then it has also helped us to come up with a child protection policy.
We also orient the staff about children and their rights, especially as we encounter to get new staffs. They have to be told about the children's rights and how they have to handle children at the place of work.